Hi, this is Kirk, the Bariatric Carnivore. Well, I just got back from the eye doc, and it was kind of cool. My doc was looking back in the back of my eye and said, "Wow, dude, you've got the macula of somebody who's in his 30s," which is not a bad thing, considering that about 11 years ago, that's when I started this whole journey toward health and losing weight. And the reason why is because when I went to the eye doctor that time, she told me that I had the beginnings of macular degeneration and that they were going to have to put shots in the back of my eye. And I was like, I did not want needles in my eyeballs. So I said, "Is there anything I can do about it?" And she said, "Yeah, lose weight." That was the best advice, that I could get from her. And, but that actually began the journey where I started, what do you do when you want to lose weight in the United States? First thing you do is you go to Weight Watchers. And I did Weight Watchers, and it didn't work for me. And I started doing some research on it and found out, it doesn't work for very many other people either. They've got a success rate somewhere around 1% for anybody that needs to lose a really significant amount of weight. So calorie restriction wasn't doing it anymore. And that's when I found out about bariatric surgery. That did have about a 75% rate of success for significant weight loss. So I did that, lost about 80 pounds doing the bariatric surgery. And when I went back in to see the eye doc, the macular degeneration was gone. And a few years later, I started developing glaucoma. And that's when I kind of started to realize, wait a second, maybe there's more to this than just losing weight. So I started doing a little bit of digging and found out that eye health is directly related to your metabolic health. And that's what kind of led to the whole low carb thing. Finding Dr. Stephen Phinney, started finding out that this type 2 diabetes was related to eye health, because the little veins and arteries in the back of the eyeball are very delicate. And they are often the canary in the coal mine that shows you when you've got real serious damage. And one of the leading causes of blindness is type 2 diabetes. It is also one of the leading causes of macular degeneration and diabetic retinopathy and cataracts and everything else. I mean, basically your eye health is dependent on, your overall metabolic health. And that's kind of surprising that we don't talk about that enough, that your ability to be able to see is really related to your blood sugar levels. And type 2 diabetes, doctors throw up their hands like, oh, well, there's nothing we can do. And that's not true. VertaHealth has proven that type 2 diabetes is remarkably, even when you're taking insulin, is reversible when you switch diets to a low-carb diet, which means you're going to have a chance to save your eyesight. And you really want to make these changes as quickly and as early as possible, because once that damage gets done because of macular degeneration, that's pretty much it. You can permanently damage your eyes. And I found a couple of pictures that show you what a difference that makes. When you have macular degeneration, this is how you start to see the world. It's almost like, everything becomes a surrealistic painting around you, and you're going to lose a lot of the vision and clarity, and it can be permanent if you don't start making the lifestyle changes. So while we often talk about the importance of heart health and not losing limbs and other things that come with type 2 diabetes, your vision is also something really important too. So you want to keep it and you want to protect it, and it's frankly scary how quickly you can lose it. And you notice the number of people that that have got cataracts, glaucoma, etc., and all these other eye problems. How much of it's related to type 2 diabetes and poor metabolic health? When you look at the number of chronic diseases that we have in this country, and almost 90% of them can be cured just by changing diet and lifestyle. So this is Kirk, the Bariatric Carnivore. I hope you can see this message clearly, and that you will look after your own eyes. And it's fascinating to me how few eye docs know enough about this, to tell their patients, hey, you are starting to gunk up in the back of your eyes, and tell you, why don't you get your A1C checked or fasting insulin? Instead of worrying about, and that's one of the problems with most of medicine. They're so siloed that they don't look at the overall picture. But this is a great area where you can take a look at the eye and hopefully realize that this, your eyes are part of your body, and that they're all related, and metabolic health affects every bit of you. And your eyes are probably your most delicate part. This is Kirk, the Bariatric Carnivore. I try to put out a couple messages each week. If you like this message, hit like and subscribe. Join this channel of other like-minded people. I will talk to you again soon.